Since I have tried to reach the copies of original manuscript, some of the slides will be black and white and old. I shall mention the English translation of slokas written above in some of the slides. Several paintings have been drawn by a devoted artist attached to the Department of Archaeology. He analyzed the description written in Sanskrit with scholars and drew accordingly. There are few controversies which I shall ignore to convey a clear concept. Appreciate that you are breathing the same air of Kashi, having the fragrance of Sushruta. I am indeed grateful to my wife, Dr. Shipra Bhattacharya, for editing presentation as always. I am only nervous when she is in the audience, really. A spark traveled from head to toe. It's very difficult to explain in words what I felt at that time. I commence this presentation with floral tribute to Maharshi. I have the privilege of spending my whole professional life in the same city, Kashi, where Sage Sushruta lived, practiced, innovated, taught, wrote, and propagated. My deliberation is based on authentic literature and discussion with archaeologists, ancient historians, and Ayurvedacharyas. This presentation will encompass ancient history, details of Maharishi Sushruta's contribution, and modern medicine. The segments are relevant references, archaeological aspect, Vedas of human mythology, history of Ayurveda, evolution of instruments by Sushruta, anatomical aspects described by him, contribution to plastic surgery, basic principles of surgery, his description about procedures, and how Sushruta influenced us. Maharishi Sushruta was the son of Maharshi Vishwamitra and disciple of Kashiraj Devadas Dhanvantari. Archaeologically, the history of Varanasi goes back to 1200 BC of continuous habitation as per the information of excavation of Adi Keshav Ghat. It says, Rajghat bears traces of ancient as well as modern habitation of man in an unbroken continuity. This site, about 0.33 kilometer from the Lal Khan's tomb, covers an area of about 1 square kilometer. The antiquity of the city and its continuous history was not confirmed by any archaeological evidence as late as 1940 AD, when the mount of Rajghat was accidentally discovered by a railway contractor in course of remodeling of the Kashi. This is the Adi Keshav Ghat, which I visited in 2002 along with the Central Excavating Team and the Archaeological Department of Varanasi Hindu University. Kashi is the earliest living city on earth. These are the old maps of Kashi. On the right you see the map which is drawn by James Prinsep in 1822 AD. He did a lot of research on Sushruta and he drew this map and said the Banaras Shahar or the city of Banaras. Sage Sushruta practiced Ayurvedic surgery. 4 main Vedas of human mythology are Rig Veda, Yajur Veda, Samveda, and Atharva Veda. Ayurveda, knowledge of life, is an evolution of Atharva Veda. This is a systematic traditional medicine originating in the Indian subcontinent. Principles of universe are fire, earth, and water. These are the paintings drawn by the same artist and not the clips. In Ayurveda, space and air come together to create three different types of bioenergies which constitute the human body. Ayurveda has 8 branches: internal medicine, pediatrics, psychiatry, ENT and Catholic diseases, surgery, toxicology, rejuvenation therapy, and aphrodisiac treatment. Shalya Chikitsa is the science of surgery and removal of foreign bodies from the body. Sushruta was not only a practitioner, but a teacher as well. The credit of using Ayurveda to combat suffering goes to Lord Dhanvantari, who was incarnated as King Devadas of Varanasi. Few influential works of that time are Charaka Samhita from the School of General Medicine and Sushruta Samhita from the School of Surgery, a compilation of the work of sage Sushruta. He learned the basics of Ayurveda from the King Devadas and laid the foundation for surgery written in the form of Sanskrit manuscript of Ayurvedic medicine. I could have the access to many of these manuscripts, the English translation of old manuscripts as well as several ones which are of recent days. Apart from that, I scrolled through several literature, and these 10 are most important one. All these forms the foundation of this lecture. He described 8 types of surgical interventions: incision, excision, puncturing, scraping, probing, extraction, draining, and stitching. Instruments used were inspired by nature. They were made up of metals, horns, and woods, again the creation of the same artist. Objects recovered from the excavation site at Rajghat in the southern outskirts of Varanasi proved that iron was widely used in Vedic era, which Sushruta would have used for surgical purposes. Look at the creation of the artist. It is an accepted fact that ancient Indian metallurgy was extremely advanced. These are some of the artifacts from the excavated sites. Instruments were either blunt or sharp. They are used even today in different specialties. Mouths of instruments resemble different birds and animals that he observed. He described 20 sharp instruments and 101 blunt instruments. He believed that to understand Ayurveda, it is important to understand the human anatomy. He would wait at the confluence of Varuna and Ganga rivers to capture and to dissect human dead bodies to teach anatomy to his disciples. This was considered desecration by most Hindus. He insisted learning embryology and then anatomy. He divided the human body into 3 categories: superficial structures, internal structures, deeper structures. He wrote details of the various organs of the body and enumerated 700 veins and 24 main arteries. During surgery, he alleviated pain by using medicated wine to intoxicate and desensitize the patient. He recognized the use of drugs and described 650 different drugs, including 395 of plant origin, 57 of animal origin, and 60 from mineral substances and metals. Contribution to plastic surgery were twofold: principles of plastic surgery and practices of plastic surgery. He did 15 different types of ear plastic, described pedicle flap for repair of damaged ear, damaged nose, and lip plastic. He said plastic surgery is a relationship between flesh and blood, where if there is an excess or lack of blood, the graft will not survive. Same was said in 20th century by Sir Harold Gillies. Plastic surgery is a race between beauty and blood supply. You can see the needle holder used by Sir Harold Gillies. He developed rhinoplasty to reconstruct noses of people who had been deformed or amputated as a form of criminal punishment. He dissected skin from the cheek and grafted onto the nose, which is the precursor of the Indian forehead rhinoplasty. Through continuity survives the need of a viable pedicle in continuity for the survival of the flap. That's what he said. And that is the essence of modern technique. For the importance of hemostasis, he said, blood is the origin of the body. The body totally depends upon it. Hence, every attempt must be made to preserve it. About the qualities of incision, he writes, it should be of adequate length, extensible, having regular and uniformly cut edges, having all the layers cleanly incised, and should be independent. The Sushruta Samhita is in two parts, Purva Tantra and Uttara Tantra. They contain 184 chapters, description of 1120 illnesses, a detailed study of anatomy and surgery adapted by most modern medical practices. Purva Tantra deals with medicine, pathology, anatomy, embryology, various therapies, and toxicology. Uttara Tantra deals with ophthalmology and hygiene. His legacy in the field of surgery varied from orthopedics, principles of various surgical procedures. Management of fracture remains unchanged. His clinical description is similar as in modern medical tests. He describes 60 different steps of managing trauma patients. He was aware of the need of wound management. After incision and removal of the cause of trouble and having made the wound bloodless, instruction should be given regarding its further management. That's what he said. Samhita also describes suturing techniques in great detail. Types of needles, different suturing materials for management of different types of wounds. He described blanket suture, continuous suture, interrupted suture, and subcuticular suture. He used round body needle, triangular cutting, curved round body, and atraumatic. In sutures, he used plant fibers, silk, horsetail hair, and heads as clips, and tendon fibers. He also wrote extensively on how to manage post-traumatic scars with variety of pastes and oils. For pigmenting procedure, depigmenting procedure, restoration of normal skin color, regrowth of hair, and depilation. He was considerably ahead of his time. The knowledge traveled to Greece, Persia, and Arabia across the ocean after his death. His rhinoplasty by Indian forehead flap is well known worldwide, though initially it was a cheek flap. How Sushruta influenced us? He highlighted the importance of anatomy and physiology. We do emphasize the same, stating that our aim is structural and functional recovery. He stated the importance of reconstruction by live tissue. So do we. Prior to surgery, he used to plan and draw based on rationality. We follow him. He planned the dimension of the flap using leaf. We also do planning in reverse with lint piece. It is also the fundamental principle today and will remain forever. He performed extensive cadaveric dissection and taught his disciples the necessity of anatomical knowledge. We do the same. We also organize cadaveric dissection workshops. He performed a variety of operations all over the body without any specific specialty, as that was the need of the society in his time. We also perform different types of procedures to impart skill and knowledge to trainees from head to toe, especially in teaching institutions. On further exploration of literature, a diagram of partial ear reconstruction emerges. It has a close bearing with the technique we use. He classified bird into 4 categories and accordingly suggested treatment relevant to the present understanding. For extensive bird wounds, he preferred to close dressing, which is also practiced by the present Ayurvedacharyas. They apply the Ayurvedic cream and put the leaves as close dressing. We also prefer close dressing. He emphasized the importance of blood supply for the success of surgery and discovery of newer methods. We are also involved in the study of vascular network and circulation in the tissue. In 1974, the black and white photograph which you are seeing, we used to do with various animals and birds with beautiful result and lot of information, followed by cadaveric dissection, CT angiography, etc. He must have faced competition with his competitors, who were equally competent. However, the world acknowledges his contribution because he wrote extensively about surgical methods and different medicines. We also know the importance of publication to establish our identity in the scientific world. These are some of the dissertations which were done by my students under my guidance. He knew the importance of dispersing knowledge to his disciples through practical demonstration, involving them as assistants with theoretical background. We try to follow similar methods. He wrote about the lacunae and how he modified to get better outcome. We also constantly analyze failures and deficiencies to improve our results. Sushruta had remarkable observation and analytical power to visualize beauty in the beast, which we should inherit. On your left, you see the myosseous flap, including the trapezius and the spine of scapula. The artist finds beauty in it, and he finds the king, the imperialism, master of all Aisarpe. Similarly, this is a case of a specimen of carcinoma cheek with lymph node dissection, and the artist finds a shell crocodile watchtower on the rock. So this is the beauty of the artist, oceanic panorama. Again, a complete mandibulectomy with extensive adamantinoma. The artist finds cat-like feline attributes. Ectopia vesicae, the artist finds chimpanzee. See, when you see the diagram of chimpanzee, then you can simulate how he drew it, how he imagined it. Otherwise, we won't be able to see this, our ancestor. With this quality, he designed a large number of surgical instruments simulating natural animals, birds, etc., which we use even today. He used several indigenous methods as per the necessity. We also keep on improving instruments, improvising instruments according to our need. We also devise many procedures. Make use of articles apart from its recommended use, such as use of dispoven needle in rhinoplasty, tendon surgery, etc. Also, a long Wenthon needle to inject local anesthesia for a large area through small prick, causing minimal pain. For example, in excision of a large benign lesion or thymocyte injection prior to liposuction, etc. He used different types of anesthetic agents to deal with variety of surgical and medical ailments. We also apply various methods of anesthesia according to the surgical procedure. He insisted for maintenance of instruments. We also take care of our key instruments personally, fine scissors, forceps, skin grafting knife, etc. He insisted to analyze results and failures in order to improve. We exactly follow it. Sushruta believed in teamwork and was surrounded by his associates in life. Guru Shishya Parampara remains the same. You can see the present president, Subodh is there, the past president, Dr. Amresh Baliyar Singh, and so many alumni of the department who are so well established and serving the suffering humanity with great results and recognition all over the country. That is why he influences every generation to walk in the path shown by him. Sushruta is the father of plastic surgery, and the Association of Plastic Surgeons of India celebrates his life and time by giving him a pride position in the association's emblem. Ladies and gentlemen, in the annals of medical history, Sushruta stands as a beacon of innovation and dedication. From pioneering technique in diverse surgery to his holistic approach to patient care, Sushruta's contribution is a fusion of skill and compassion. As a medical professional, his legacy should always serve as a definitive resource for advancements, bearing in mind that every patient is a reflection of the humanity we are privileged to serve. Thus, we march forward on the path shown by Sushruta with pride, acquiring the advancement in knowledge and technology. Thank you very much for patient hearing.
Thank you so much, sir, for making us aware of our rich heritage as far as plastic surgery is concerned.